Hi, everyone, and welcome. This is Richard Mollett with the Long-Term Care Community Coalition. We're going to get started in just a minute or two. While we're waiting, a few virtual meeting tips. Please submit your questions, any questions you have for today's speaker in the Q&A at the bottom of the screen. Please do not submit questions in the chat because we are not going to be monitoring or using the chat at the end of the program for Q&A. So again, please put any questions you have in the Q&A at the bottom of your Zoom screen. You can use the chat. You're more than welcome to for comments, for conversations. If you have any technical issues, we'll try to help you out. You can let us know in the chat. A few things new at Nursing Home 411. Our new senior care policy brief just came out this morning on industry influence, the nursing home industry, and Sam will talk a bit about this today. Constantly says that they are lacking enough funds to provide better care, to provide better staffing, etc. And meanwhile, they're openly bragging about how well they're doing in terms of both finances and in reducing requirements. You can also see our comments on, opposing the repeal of the nursing home staffing standard that was issued under the Biden administration, our latest Elder Justice newsletter, and our January webinar, Resident Falls and Special Focus Facilities, is on our website and on our YouTube channel. So again, quickly before we get started, it's 101. Please submit any questions you have for Sam. We're going to leave time at the end of the program in the Q&A in the bottom of your Zoom Zoom screen, excuse me. And then you're welcome to use the chat for chatting and for comments. And if you have any technical issues, please let us know there. But again, please put any questions you have in the Q&A. A little bit about LTCCC. If you're not familiar with us, Long-Term Care Community Coalition, we are a nonprofit, nonpartisan organization entirely dedicated to improving care and quality of life for people in nursing homes and assisted living. We carry out our mission through policy research and analysis. We provide a lot of data to the public and do data analysis ourselves on nursing home staffing, nursing home quality, nursing home ownership, and other issues. We use that in our systems advocacy and to support our public education. And lastly, we're the proud home of two local long-term care Ombudsman programs here in New York State. Our website is nursingHome411.org. Today's webinar, Where Does All the Money Go? Exploring how New Jersey nursing homes use public money. I am really excited and proud to introduce Sam Brooks. He is the policy director of the National Consumer Voice for Quality Long-Term Care. Sam is one of the most outstanding people that I've met in my career. He's smart, he's thoughtful, he really gets it. And those things are pretty rare on their own and extremely rare altogether. And Sam has just been an inspiration and is deeply appreciated both by me, both personally and professionally. And with that, actually, I just wanted to say one more thing. I'm sorry. I just wanted to make a personal note that I have both a personal and professional interest in New Jersey nursing homes. I've had family members in New Jersey nursing homes. I'm working from New Jersey right now in my home office. And we've had, at LTCCC, long-standing concerns about the quality of nursing home care in New Jersey and about program integrity of nursing homes in New Jersey, especially as the industry has become more corporatized. And so I'm really excited that we'll have Sam that are touching on these things. And I just want to note that even though this is focused on Sam's report in New Jersey, that the study and the report really have been done in any state. I mean, Sam, I believe, I can't speak for him, of course, they focused on specific owners in a specific state, but this is what we see, hear, and read about from state, in facilities, among operators across the country. So this is relevant to everyone, no matter where you live. Everyone is interested in nursing care. And with that, I'm going to, oh, I should just say, sorry, for materials from today's webinar, and Haley already posted the webinar slides. They're on our website at this page. And with that, I'm going to stop sharing and hand it over to Sam. Welcome, Sam, and thank you.
Thank you, Richard, and thank you for the kind words. We certainly share the consumer voice, and I too certainly share um, uh, the fondness for LTCC and both you and Haley, and just the amazing work that you do as an organization to protect nursing home residents. And really an honor to be here today and to be with all of you. Let me see if I can get my slides up here and we'll get going. Just 1 second. I don't think that's the right one. Hold on 1 second. Can you see, are those, do we see them now?
I don't.
No, you're not sharing quite yet.
All right, hold on 1 second. Let me try this again. How's that?
There we go. That's good.
Yes.
Thanks.
Thanks, Sam.
Sorry about that. I'm a little technologically challenged. Again, thank you, Richard, and thank you, Haley, for having me. It's really an honor to be here. And it's really nice to be with all of you virtually. Uh, we're going to talk today about a report that we issued a couple months back. But as Richard said, this report really could have been done in any state, territory, or location in the United States. This is something that Consumer Voice, along with LTCC, has been exploring for years. And this is just a sliver of some of the practices that we see and some of the concerns that we have about care. As Richard said, I'm Sam Brooks. I'm the Director of Public Policy of the National Consumer Voice for Quality Long-Term Care, or the Consumer Voice, as many of you probably know. We are a nonprofit organization celebrating our 50th year this year. We advocate for policies that support quality of care and quality of life responsive to consumers' needs in all long-term care settings. We empower and educate consumers and families with knowledge and tools they need to advocate for themselves. We train and support individuals and groups that empower and advocate for consumers of long-term care. And we also promote the critical role of direct care workers and best practices in quality care delivery. So what we're talking about today is a report that we did in 2025. We released in 2025 called Where Does All the Money Go? Exploring how New Jersey nursing homes use public money. And again, and I'll share links to our website at the end. We've done a couple reports like this. One that was not necessarily centered on a specific geography, and we had also have done a report in Michigan. This report was done with support and critical expertise from New Jersey AARP and the New Jersey Office of the State Long-Term Care Ombudsman, who are at the front lines of care quality in nursing homes and other long-term care settings. You can access the full report by going to that link, and we'll get right into it. So just an overview of this, and we'll get down into the nitty-gritty about what all these titles and terms mean. What we're really going to be talking about today are related party companies, and how nursing homes, particularly or specifically for-profit nursing homes, use related parties across the country, and what that can mean for care. And just some highlights from this report. In the years 2021 to 2023, New Jersey nursing homes paid related party companies nearly $2 billion. And related party companies, we'll get to the definition in a second, are companies that do business with a nursing home but have shared ownership. The companies are owned by the same owners that own the nursing home. We looked at three chains, and we'll go through them in time, that examined, that had approximately 32 homes, and they paid roughly $206 million to related parties over 3 years. According to a recent study, and we'll talk about that as well, that's almost $50 million in profits that could be hidden And we don't know. And that's the moral of this story is we just don't have enough information to know in real estate and management fees alone. So let's get right into the report. Really, let's talk about
Sam,
really, yes.
Sam, sorry to interrupt. There's just been a couple people asking you to speak up just a little bit, if you could.
Okay.
Thanks so much.
Yep. All right. So let's talk about the rise of related parties. So I was getting comfortable here. Well, what is a related party? As I said, a related party is a company doing business with a nursing home that has the same owners as the nursing home. These are typically real estate companies, management companies, staffing companies, laundry companies. I saw a photocopier company once. Any type of company that you can imagine that might be able to do business with a nursing home can be a related party. And the key point here is that these are companies that have shared ownership. Really, where this came out of was an article in the early 2000s that suggested if you separate the physical plant, the bricks and mortar, from the operations of the nursing home, you can protect it from civil judgments or any other types of liabilities. The idea being that if you sue a nursing home, but the nursing home that is operating doesn't actually is renting the facility, you can't get anything from it. So what the idea would be, we would sell the physical plant. I would buy a nursing home. I would sell it to a property company, Brooks Property Company. And then Brooks Property Company would own that nursing home. And in turn, that property company would start charging the nursing home rent. The key being here is I own both companies. What that developed into was a way, or what many in the industry discovered, this is a way that you could do business with nursing homes, charge them fees, potentially inflated fees, and what that would do would not only disguise potentially profits, because these are monies being paid out of the nursing home to companies I own, but it makes the nursing home look less profitable. All of these show up as expenses on cost reports and other public information that nursing homes are required to disclose. So if I'm paying myself rent, the nursing home is showing an expense of so much rent, but that rent is being paid to me. So there's a lot that's intuitive, I think, as human beings to say, wow, that's a bit strange. And that's what we're going to be talking about today, are these practices and just how we don't have enough information about these practices to assess just where this money is going. So CMS requires these transactions to be reasonable. It must be what you would have paid if it was an arm length transaction. If you go out and buy 100 widgets from yourself, it has to be what you would have paid from a non-related third-party widget seller. Just makes sense. We don't want you inflating costs you're paying to yourself. CMS requires this. However, although these costs are reported annually, CMS does little to nothing to police these transactions, and we'll talk about that a little more. OAG report last year found extreme flaws with how CMS looked at related party transactions, and we know this from just the quality of the data that is reported to CMS. Neither CMS or New Jersey gather enough information to determine whether these transactions are reasonable. Generally, how these are reported are a cost and a payment. This is how much that was the allowable cost, and this is what we paid. There's no real substance to that. There's no value, what you got for that. It's just two numbers, really. And neither the state or the feds really get enough information to ascertain the reasonableness of these costs. In 2019, related party spending exceeded $11 billion. So $11 billion were run, at least $11 billion were run through companies that nursing homes own. And this is nationally. There hasn't been a lot of what we talk about related parties, and advocates have been talking about it for years now, has been speculative. Access to high quality cost information has been scarce until recently, but more and more people are taking a look at just how these practices work and what they can mean to care and also to the finances for nursing homes. An important paper by two professors, Gandhi and Alensky, came out in 2024. They looked at related party spending in Illinois. Illinois has particularly strong reporting requirements. And what they did is they went through and they looked at nursing homes kind of before and after, comparing what the costs were for nursing homes that potentially didn't have related parties, and then what happened after. I really encourage you to read the paper. Some of it's very heady, but nevertheless, what they found was that potentially 68% of industry profits are hidden in related party transactions. It's over 2/3 of the profits that industries may reap or make are hidden in these types of transactions. And you can see why that would potentially be. There's just little oversight. That money goes through, and it's really not clear where it goes after that. 77% of all related party transactions are related to real estate and management fees. Again, real estate is the idea that the nursing home is paying rent to a property company. And we'll talk more about those real estate costs in a little bit. Management fees. The idea that you have a management company. Every nursing home now has a management company, and that management company can charge up sometimes $400,000-$500,000. I've seen over $1 million in management fees. So a nursing home is paying to a company that manages it hundreds of thousands of dollars. And if you scale this, we're talking about millions of dollars a year that are flowing through management companies that, again, are owned by the same owners. In 2001, to give you an idea of just how this is scaled up since the introduction of the idea of related parties. Related party transactions in Illinois equaled 365 million in 2021. That grew to $806 million. So we're talking about lots and lots of money. And what we're learning also, and there's going to be more coming out about this, when we're looking at related party transactions, particularly around the real estate, and this is outside of this report, but I wanted to touch on it here. Thanks to some great work done by the acting New Jersey comptroller, who has just left office, Kevin Walsh, in his office. They've discovered some really troubling, but I think widespread practices. What we see often in these related party costs, we see huge rent payments. Millions, $4 million, $5 million a year a nursing home is paying to the real estate company in rent. And until recently, we had not that much information on what that was and where it was going. But what Kevin Walsh did and his office did is they discovered that what was happening here in many cases is that the nursing home was mortgaging that property to the gills. For instance, a nursing home may be purchased for $4 million. I found one in Virginia the other day, that was purchased for $6 million in 2021 and just had a guaranteed mortgage of $48 million in 2025, guaranteed by HUD. So the nursing home paid $6 million for this facility, for the bricks and mortar, and then went out and got a mortgage on the property for almost $50 million. And what you next see is that the rent goes up. So the year before that nursing home was purchased, the capital costs were about $400,000 a year. The next year it was $4 million. So what is happening is these properties are being extremely leveraged. They're not just valuing the property anymore, they're valuing the actual receipts of the company. They're looking at how much a nursing home can pay in a mortgage, and they're giving these huge amounts of mortgage, 30, $40 million mortgages, and then requiring, as part of the mortgage documents, and I've seen this, requiring the nursing home to pay that mortgage. So you have really underperforming nursing homes that are doing poorly, and then they're purchased up and oftentimes mortgaged to the gills. And instead of paying $400,000 in capital costs, they're now paying $4 million. You can imagine what that's going to do to the care in that facility. That $4 million has to come from somewhere, and it comes from staffing, food quality, and there's more to come on that, but I wanted to touch upon it. In our report, we relied on all public data, and that has to be critical. The data that we relied on is all available to the public. Some of it is more reliable than others, and we'll talk about it. So for this report, we relied on Medicare cost reports, or CMS 2540-10. These are filed annually by all nursing homes. They're notoriously unreliable. CMS does not look at these reports. We often find reports that are blank, have clearly wrong information from years ago, and clearly reflect that really no one has been reviewing them. It really undermines any reliance on these reports. Unfortunately, some folks, researchers or others, use these reports to gauge the efficacy or the amount of money that goes toward that is available towards care, but they can't be. It's all self-reported data. It's not audited. It's not reviewed by CMS. So unfortunately, it's not great, but it's what we have. And it's just the cost information at the federal level. States like New Jersey have Medicaid cost reports. We did not use them for this report. We just didn't have access to them. But that is the financial information we use. We also use the payroll-based journal. Briefly, that's time records submitted to CMS by all nursing homes. These are nursing homes are required to submit payroll data. How many CNAs worked on this day? How many RNs worked on this day? How many LPNs? And Richard, to his credit, publishes a lot of this data, all of it, on his website, and it shows how much staff is in a certain nursing home. We're learning more and more about this. Unfortunately, that these numbers are inflated, that oftentimes when you cross-check this data with, say, punch cards or actual time cards, you'll see that the payroll data is inflated as well. But that's what we have. And we also use 5-star quality data. CMS maintains a website many of you are aware of, CareCompare. CareCompare uses a variety of measures: a staffing measure based on staffing, a health inspection measure, a quality measure rating, and an overall rating. Again, some of these are more reliable than others. The quality measure rating we tend to ignore because it's self-reported data. You see a lot of nursing homes with 5-star quality ratings, despite having 1-star staffing and 1-star health inspection ratings. And they're not clinical, they're relative. They compare how one nursing home performs to another. It does not have, so it's a curve. But nevertheless, what I say is, if you're in a 1-star home or a 2-star home, you know that's a 1-star or 2-star home. If you're in a 5-star home, you don't necessarily know that. You have to do more research. Throughout the report, we use nonprofit homes as a comparison. We compare these, the homes that we examined, to all New Jersey nursing homes, but we also compare them to nonprofit homes for reference. So let's talk about the chains we reviewed, and we picked some randomly and went through and did some analysis. So overall, over the 3-year period, New Jersey nursing homes paid to related party companies nearly $2 billion. That's all related party spending in New Jersey, not the, that's all nursing homes in New Jersey. We looked at three chains, Marquis, Genesis, and the Rosenberg family that comprise about 32 homes. Some of these homes, some are more, some are less now. Some of these chains own more, some own less. We used what data? We used the 2024 quality and staffing data from CMS, while we used the cost reports from 2021 to 2023. The idea being we want to, you have these practices and this is how it plays out in 2024. Some cost reports weren't available for facilities, so we just did not include them in the study. And again, this is all public information available to all of us. We just did a little analysis. So let's talk about these homes, and let's talk about Genesis first. Many of you have heard of Genesis. Genesis is a big player in the nursing home arena. It just recently has gone through or is going through a very large bankruptcy that is largely a result of private equity involvement and the fleecing of the nursing homes themselves. And we'll talk a little bit more about that. So for the 3 years that Genesis submitted cost reports, the cost reports, excuse me, for the nursing homes that we looked at for the 3 years showed $73 million in related party payments. These are payments that Genesis made to themselves, that Genesis nursing homes made to themselves through companies like management companies and real estate companies. They reported a loss of $32.2 million, those same homes. That's a significant loss, clearly. 12.4 million were in related party expense, excuse me, in real estate related party expenses, and 17.8 million were in management fees. And just for to estimate, we use the numbers from the Gandhi report to estimate how much could be hidden profits. Again, we don't know. We don't know what is profit because neither the federal government nor the states, New Jersey, requires enough information for us to ascertain what the profits were to these related party companies and the owners. So we just use those to speculate. That could be 12 million, it could be less, it could be more. We just don't know. But using the Gandhi and Alensky paper that we mentioned before, that was what it could be. The average 5-star rating for nursing homes, for Genesis nursing home, was 2.75. So pretty less than average. And at the end of my presentation, we're going to feature some quotes from residents that the New Jersey Long-Term Care Ombudsman Program actually talked with residents that live in Genesis and live in the Rosenberg family and live in Marquis homes, and got some quotes from what this means. What does it mean to live in a 2.75 nursing home, 5-star nursing home? And what does it mean to live in a nursing home that's staffed at 3.31 hours per resident a day? So that number is 3 hours and about 24 minutes of direct care per resident per day. So that means how many, technically it should be how much care an average resident is receiving in that facilities from RNs, CNAs, and LPNs. Again, the numbers are a bit inflated. RNs, administrative RNs are counted, but it's the numbers that we have. So that is 31 minutes less than the average nursing home in New Jersey. So half an hour less. That's a lot of time. That's a huge amount of time. And that's really a significant impact on the quality of life and also the health of residents. That's 81 minutes less than the average nonprofit in New Jersey. So it gives you an idea of the level, the quality of care and the level of staffing. And again, this is to show, we're not saying one is related to the other, but where there's smoke, there's fire often. And this money is being funneled out. This is money that could be potentially going to staffing. These real estate expenses, management fees, they go a long way. That money could go a long way to creating better health outcomes for residents. And if you followed recently the Genesis was going through a very highly structured bankruptcy. The private equity investors, what they wanted to do, well, speculating what they wanted to do, or what it's been written about, is because of the quality of care in Genesis Homes, they've accrued significant liabilities, particularly civil judgments, because of poor care. They wanted to go through bankruptcy, discharge those debts, have them removed, and then purchase the assets back. This is something that's very common, unfortunately. The idea being, I'll create another company and we'll discharge our debts, and then my other company, which I own, it's almost like a related party bankruptcy, will purchase them back. To her credit, Senator Elizabeth Warren wrote a scathing letter about this, or an amicus brief, excuse me, to the bankruptcy court, and the brakes got somewhat put on. The bidder that was connected to the original owner was not given the facility, although I can't say that the new owners are going to be providing the type of high quality care that we like. Again, it's opaque. Unfortunately, with nursing homes, we frequently don't know who owns them, who runs them, and we only learn later when there's catastrophic effects. Let's talk about the Rosenberg family homes. Just let me check my time here. I think we're going okay. Rosenberg family, I think they, if I recall, 6 homes. And during the 3-year period, they made $43.52 million in related party payments. Nevertheless, and you compare this to Genesis, they still reported a profit for those 3 years of almost $8 million. $33.6 million in real estate expenses were made, and $2.8 million in management fees. So again, using the Gandhi and Alensky numbers, that's potentially $13 million in hidden profits. The average 5-star rating for their nursing homes is 1.83. Very low, the lowest that we did analyze. Very discouraging. The average staffing per resident per day was 3.35. Similar. It's funny how a lot of these for-profit homes staff almost at similar levels. I think there's a kind of an algorithm or an equation that you can use to maximize your profits. 31 minutes less than the average nursing home, 81 minutes less than the average nonprofit. Again, millions and millions of dollars going into real estate expenses and management fees. We don't know where they're going, and we should be concerned. To highlight how related party transactions make nursing homes look less profitable, I pulled out one home in the report. And this is true. This is very common across the country. To see this type of these types of numbers. So Majestic Care Center, over the 3-year period, reported a loss of $675,400. So these homes are losing, maybe $200,000 a year. However, during that same time, it paid related party companies. So it paid to companies they themselves owned $6.3 million in related party transactions. $4.83 million was rent payments to itself. That shows up as an expense. So these $6.3 million in related parties go as a debit, and it goes on the cost report. So when you have your cost report, it helps. You can take it to your state legislature and your legislator and say, look at my nursing home. I'm losing $700,000 a year. You're not giving me enough in Medicaid. But if you look closely, millions are being paid to themselves through rent and other costs. Again, that could be all legitimate payments, but we don't know. And we need to know, because we know that many nursing homes in New Jersey are providing high quality care. Why can't some of these? Why are these practices so common? I mean, when I get a call about nursing homes and quality, and we pull the cost data, what we frequently see, it's the same thing over and over again, these types of practices. From 2021 to 2023, oh, excuse me, this is the wrong slide here, so let's skip that. I'm sorry. We're going to move to Marquee. Marquee, during the same time period, paid roughly 90 million, 89.62 million related party payments. Profit was 16.82 million. 51.5 million in real estate related expenses, about 13 million in management fees. Again, using the speculating using the Gandhi and Alensky paper, it could mean that almost $24 million were in hidden profits. Again, the more, I can't say this enough, we don't know, and we should know. The average 5-star rating in the nursing homes is 2.57. Again, this was data from 2024 after we looked at 3 years of cost reports, and then we looked at what the care was at the end of 2024. And the average staffing per resident day was 3.18. So this was the lowest of the nursing homes that we looked at. 39 minutes less than the average nursing home in New Jersey, 89 minutes less than the average nonprofit. Again, looking at this one, we looked at Coral Harbor, similar example here. They reported a loss of over the 3-year periods of $60,400. On paper, their nursing homes looked like they were losing money. But during that same time, it paid related parties $8.1 million. Even 5% of that was hidden profit. If it was, you could see how this would change considerably the financial picture of this nursing home. From 2021 to 2023, they reported $90 million in related party payments, but claimed only $82.3 million were Medicare allowable costs. That's an excess payment of $7.4 million. On the cost reports, you're required to disclose just what the allowable cost was under Medicare and what the payment was. And oftentimes, unfortunately, and frequently, the costs, the payments far exceed the allowable costs. And certainly, maybe Medicare dollars weren't used, but that money is coming from somewhere, and it's being drained potentially from care. And that's why we need more information. So I want to walk through some quotes from residents from these facilities. I think it's important. All of this information can be very abstract, related parties, profits, all of these things. And I try not to talk about them, and we have to talk about them in a way that doesn't dehumanize residents and family members. We all know, as people who advocate for nursing home residents and want better care, it's not hard to go and find a story every day across the country about a nursing home resident suffering. So you really need to try to connect a lot of this kind of arcane stuff to what's going on in facilities. So these are quotes, and I'm going to read them from residents. Where's the money going? It's clearly not going to the care, to the basics like hydration. Residents are sent to the hospital because of dehydration. They don't even pass out water in the afternoon. If you're lucky, you get in the morning, and that's from the sink where it's brown. The food is often cold and tasteless. It's hard to enjoy my meals when they're cold. The past 2 food service directors have worked really hard to respond to the residents' request, but there's not enough money from the corporate office. And I think that's important to point out. Oftentimes with nursing homes, or particularly for-profit nursing homes, they're given a monthly budget by corporate, and they said, this is how much money you have to spend each year. We don't have enough money to give you any more. And the administrator and the staff are tasked with providing high quality care on a budget that just can't meet it. And they're often told that there isn't enough money. And unfortunately, they believe it. They tell workers there isn't enough money. They tell that families there isn't. This is really something, these decisions are being made at the highest level and not in the facility themselves. More quotes. They've run out of chucks, which are incontinence pads. How can you be a nursing home and not have any? They run out of toilet paper, diapers, paper towels, hand soap in their rooms, disposable washcloths. We never get to go out to stores or trips. They have been saying they're going to fix the van, but it's been years now. Some of the towels are so thin that they rip when I'm drying myself. That's horrible and embarrassing. Simple quote here, staffing has always been horrible. They're supposed to do incontinent rounds every 2 hours. We were with my mother from 12 to 8:30 and saw my mother's roommate never even attended to. People came in, put the tray down, take the lid off, time for dinner, put it back, take it out, never turn, never check, never change. She also needs help eating, nothing. So many times someone comes into the room and says they're not your aide, but they turn off the call bell and it's so long before anyone that will actually help shows up. It's important to note that these are all randomized. Many of the residents who shared these quotes were feared retaliation. So none of them are specifically attributed to residents in specific nursing homes, but they were all residents that resided in one of these nursing homes owned by these chains. So where are we? Frankly, I've been talking about, and Richard and Haley and others have been talking about finances for years. We've talked about it as really we can do all of these other things. We can implement staffing standards. We can do value-based payments. We can do all of those things, but it's not going to help until we require that the billions of dollars that we provide to nursing homes go to care. So what can we do? New Jersey is on the front lines right now of trying to get some really important legislation passed. Credit to AARP and to the Long-Term Care Ombudsman Program and other advocates there. They have a transparency organization there that's doing wonderful work. Senate Bill 2980 would require increased disclosure of finances and ownership. It's being held up in the legislature. We need New Jersey folks to contact their legislators and tell them that we want this type of legislation. What it would do is require top-down disclosure of who owns a nursing home, how much is being spent on related parties, where it's going. And transparency should be tied to rate increases. Nursing homes continue to get increase in rates, but we don't see better care. We need increased auditing of cost reports. CMS, I can speak at the federal level. I'm not familiar with New Jersey. Don't look at these reports. This is just information that's coming in and sitting there. The only people that look at them are researchers and people like me that have no life, but other than to look at nursing home finances. There needs to be accountability. These should be required to be audited. And a CPA should attest to the veracity of the content in those in the reports. Justification for related party payments. We want to know what you got. Why are you paying? Why did you purchase a home for $8 million and then the next year start paying $4 million? That home start paying $4 million in rent. How is that possible? How can your capital costs increase by a factor of 10 over 1 year? We need a medical loss ratio. In New Jersey, and I'll talk about this a little, medical loss ratio is the idea of every dollar, Medicare and Medicaid dollars should go to direct care. New Jersey has a law. New Jersey passed some really progressive and forward-looking legislation after COVID. Unfortunately, it was watered down. New Jersey has a law requiring a direct spending requirement, but it includes everything. It includes depreciation, interest on loans, so much so that it swallows the whole rule. And it gives a distorted look about how much is being spent. We need a medical loss ratio that counts only the dollars that are going towards direct care. And direct care, again, it's broader than just the staff, but it can't be every absolute expense. And importantly, and again, my credit goes to Kevin Walsh, the comptroller from New Jersey, the former comptroller in New Jersey. We need to limit the leveraging of nursing home properties through mortgages. HUD right now is guaranteeing millions. HUD last year guaranteed $8 billion in mortgages for nursing homes. About 75 of them were 1 or 2 star homes. We need a process that we're not allowing nursing homes to leverage the facility. And why is that? Why is it wrong for a nursing home to get a $40 million mortgage on a property that it paid for $8 million? It's wrong because one, we don't see that money, that additional $30 million they get. It's not going towards care. We're not sure where it's going. And two, the nursing home's paying that mortgage. So we are, as Medicare and Medicaid recipients. This is broader than the report. We did not get into this in the report. I'm not alleging that any of the facilities that we talked about did this, but these are some, as we learn more almost daily about finances, we're seeing more and more of these practices of where the money is going. Billions are being taken from nursing homes through these types of practices. And then it falls on the nursing home themselves to pay that mortgage back. And when you can't provide good care paying $400,000 in rent, you're certainly not going to provide good care paying $4 million in rent. So these are some of the critical things that we see as consumer voice, and I suspect Richard and Haley at LTCCC see as well as critical to making sure that we protect nursing home residents. Until we make sure that the money that we are spending are going towards care, we're going to continue to see these types of outcomes, no matter how many regulations we pass. Until we get to the money and require that it goes towards care, we're not going to see the type of health outcomes that older and disabled individuals and New Jerseyans deserve. And that's enough out of me. I've talked long enough, I think. I'm happy to answer any questions if there are any.
That was wonderful, Sam. Thank you. It's as you noted, it's so complex and there's so many things going on, and I just really appreciate especially how you brought the residents' voice in, because we as family members, an ombudsman see that, and it's so often hard to make that connection when we're talking about the broader policy and financial issues, which can be very complex. Sam has a slide on Connect with the Consumer Voice. If anyone wants to see that again, all the slides are available on our website right now. And then I am going to quickly share my screen, if that's okay, Sam, with a couple of closing items for us. And there we go. Okay, pardon my oops, sorry about that. So our next webinar is on March 17th at 1 p.m. The topic is Failures in Advanced Care Planning, Content Analysis of CPR-related Immediate Jeopardy Citations in Nursing Homes. And this is actually a program that was presented at the last Consumer Voice Conference in celebration of their 50th anniversary, as Sam mentioned earlier. And it was just a fascinating program. And so we invited the speakers to join us next month. It sounds very complex, but actually what it does, and I think what is really valuable for us as ombudsmen and advocates and agency staff, et cetera, is it takes the speakers take us through the statements of deficiencies and how those statements of deficiencies reflect or not what is going on in the facility. So I found it really incredibly valuable and insightful. So I hope that you join us for that. Lastly, head to Nursing Home 411 again for materials from today's webinar. We're on social media, Facebook, Instagram, Blue Sky. Visit our Learning Center for our new Nursing Home Staffing Resource Center, data information on U.S. nursing homes. We have a whole bunch of fact sheets on key nursing home standards and dementia care standards, assisted living guides, and more. If you're able to, we welcome you to support our mission. All donations are tax deductible and welcome. And lastly, for updates and invites to future programs, visit us on the web, or you can scan the QR code there. Long-term care ombudsman, if you are attending this for an in-service program, you will receive confirmation of your attendance on Thursday. And now I'm going to stop sharing and open this up for questions. And our first question is from Ilan Caspi. Hi, Ilan. Can you share who are the U.S. senators who are champions in tackling this issue?
Sure, I can. There has been over the years, there's been different interest in it. It's been a bipartisan issue. Currently, right now, I think our strongest champions in the Senate are Senator Wyden and Senate in Finance. He is certainly at the forefront of thinking about better care for nursing home residents, and understands these issues. He has a wonderful staff that works on these issues. So we certainly see him as a champion and of this issue in the Senate. Elizabeth Warren as well. She is, as you know, a very brilliant when it comes to finances, and she has been wading into these issues more and more and seeing this as an issue of how taxpayer dollars are used and how that money is used. So, and they come, the more we talk about this, we have shifted the conversation, I think, over the past several years to more scrutiny on the finances. And frankly, the more senators that learn about this, the more that become interested and want to take up the mantle of reform. In the House, we have the incomparable Jan Schakowsky and Representative Doggett, and certainly Chairman Neal, or former Chairman Neal of the Ways and Means Committee, and many others, even AOC, Representative Ocasio-Cortez has taken this issue up. So more and more people are seeing this as an issue of justice for residents.
Thanks. I'm going to combine the next two questions, and we have a lot of questions. Thank you. So I'll try to get to what I can. But Catherine Kit Paternoster and actually Charles Clarkson asked similar questions. So I'm going to go with Catherine's, which is a little more broad. If related party transactions siphon money away from resident care and paying staff a living wage, how can we not view this as fraud? And why does CMS not follow the money, in your opinion?
It's a great question. And again, we don't have enough information to determine whether it is fraud, right? This money goes out the door. I mean, there are instances, certainly, recent cases in New York and New Jersey. Again, the comptroller there did some wonderful work alleging fraud. You really have to get into it. And I don't know why CMS is so entrenched in this position. I think it thinks that we pay the money, and that's just how it is. We have pled with them and asked them and sent them this information showing that what we think is a relationship between money being potentially funneled away from care. And they just don't seem, I don't say they don't care, but they just don't seem to do anything. And the OIG report, which I can share too with folks if they email me last year, really reaffirmed that. That they're just not doing enough to ensure that these transactions are above board. And it's a huge concern. And it's frustrating, and we need more pressure on CMS to do its job as the overseer of these critical programs, Medicare and Medicaid.
Thanks, Sam. Anonymous attendee, this is focused on New Jersey. So do different states have stronger, weaker oversight on this, even if CMS is allowing it?
Right. That's a great question, and one that we've been working at Consumer Voice. I mean, we've seen and we've recognized CMS's failure to act. So we've tried to work with states, including New Jersey, to implement policies and procedures and laws or regulations that would get to this. And some states do have better cost reporting. California, Illinois, Michigan has been doing some fantastic work. Connecticut. And even Pennsylvania, not even Pennsylvania. I'm from Pennsylvania, so but Pennsylvania as well has implemented some cost reporting requirements. If the federal government refuses to do it, it's incumbent upon state actors to implement some of these policies, because these are taxpayer dollars being siphoned away. And remember, with the Medicaid cuts, $1 trillion in Medicaid cuts, budgets are going to constrict, and we need every dollar that we do spend on long-term care to go towards long-term care. So yes, there are some states out there. We're working on a brief now that we'll be putting out that compare different state actions and how they perform across the country. And again, they're only good as they're implemented. Virginia has nice cost reporting requirements, but they're not really enforced that well. I know Massachusetts has some similar stuff. It's really about persistence.
Thanks, Sam. And I'll just quickly, Erica Berman had a rhetorical question, but I thought it was worth stating. There are enough legislators with family members in nursing homes. Why do they allow for poor quality of care, substandard staffing, and other personal and financial exploitation?
Your guess is as good as mine. I mean, uh, why, after the COVID pandemic, there was some political initiative. People saw the devastating impact that poor care had on nursing home residents, and there was some initiative there. It's incumbent upon us as advocates and as voters to make this an issue that turns elections. The legislators just don't face consequences for not supporting policies that protect nursing home residents, and we have to work on ways to make them responsive.
Thanks. And that kind of relates to Pat Garcia's question about what is the incentive for legislators to turn a blind eye to these practices?
Well, to the industry's credit, they spend millions and millions and millions and millions of Medicare and Medicaid dollars each year lobbying nursing home. There was just a article in the New York Times that suggested that they lobbying helped have the nursing home staffing rule rescinded. There's in every state there is a lobbyist that goes to the Hill every day and tells legislators and their staff that they don't get enough money, and it's very effective. A lot of our jobs as advocates are trying to deprogram staffers who have just been not told the truth for so long. And when we use this data, it often really opens the eyes. But what we have on our side is justice and truth. We don't have money. We don't have the type of scale that we can put 50 people into, each state. We can't fly everyone in and do all of those things. But what we try to do is lift up the voices of residents. And that's our best tool.
Thanks, Sam. Thank you. Anonymous attendee asked, do you have any thoughts on how to determine whether the amount of rent or management fee costs reported as related party transactions are comparable to arm's length transactions? Is there any source available for comparison?
That's a great, and again, I referred to the Alensky and Gandhi report. That's how they came to their conclusions, as they looked at arm's length transactions, and then they compared rents and costs and other management fees to what they were when they were related party transactions. And that's what they saw. They found that the costs when the related parties were involved were significantly higher, 30–40% higher at times. And we often see it too, and I see it as well when you're examining it before and after. So a nursing home as I said before, a nursing home was purchased in 2021 in Virginia, and it had $400,000 in capital costs. Next year, it had $4 million. Why would the rent go up by a factor of 10? We know now, we're learning more, it's because that nursing home's paying back a mortgage that the money's already gone. So we need more information, but you're absolutely right, anonymous attendee. We don't have enough. And that's what these bills call for, is you need to show us what you got and what you would have paid if it wasn't a related party transaction.
Thanks. I'm going to combine a couple of questions that relate to what you were just talking about, Pat Garcia and Lori Brewer. Hi, Lori. Please help me understand. They use the mortgages as a loan to spend any way they want. And Lori asked, what criteria are the banks looking at to make these HUD guaranteed loans? Obviously not quality.
Yeah, it's very interesting. I don't know, and I have to speculate. And again, and I can't say this enough, Kevin Walsh really turned me on to this idea that it's all public. If you go look at the HUD website, you're seeing the same banks over and over again getting these types of mortgages guaranteed by by HUD, by by FHA. Just last week in McKnight's, there was an article about the new FHA head who used to be a nursing home insider, was bragging about how they doubled the amount of loans that they've given out. We don't know what they're looking at. I think essentially what they're looking at is the ability for the nursing home to pay the mortgage. How much Medicare and Medicaid dollars can the nursing home use to pay the mortgage? And then that's the amount of mortgage you can get. It's the only explanation to me, because these homes, I was able to, in 2025, I was able to match 37 homes were 1-star home, 38 were 2-star. We're not looking at quality, right? And the problem is HUD knows this. I mean, HUD is looking at a lot of these operators have years and years and years of history of poor care. And now they're even saddling that nursing home with even more debt. So yes, sorry, I could go on and on.
Thanks. So, well, if you don't mind, we're going to take like maybe 3 minutes or so for 2 more questions.
Yeah, please.
I know we're at 2:00. Carol Levy asked, can you talk a little more about how you use the Gandhi Alinsky paper to estimate, hidden profits? Thank you.
Sure. And again, that was an estimate, and I certainly Professors Gandhi and Alinsky's will also say they were estimating. I don't remember the exact numbers, but I think it was 30. They estimated that 36% of real estate costs were hidden profits, and 38% of management fees. Again, I'm not sure of the quite numbers. I encourage you to read the paper. It's also in our report. I just have so many percentages in my head. So we just use those percentages and to determine, what percentage of these real estate costs, what percentage of these managed fees, according to the Gandhi and Alinsky paper, could be hidden profits. Again, it's just an estimate to give an illustration. The fact is these practices are the same across the country. Related party practices aren't different than, they might be tailored a little differently, but you see these behaviors everywhere across the country.
Thanks. And then the last question, sorry, everyone. So we've run over, but Eileen Henshaw asked, what is the status of medical loss ratio legislation in states other than New Jersey, Illinois, Maine, Ohio? How are these working?
To be honest, I'm not sure. I know Massachusetts has a medical loss ratio. The problem is getting it enforced. And a lot of these are so new, these rules are so new that we just don't have enough data or information yet. And again, New Jersey's a good illustration, is it really depends on what you're looking at as well. And we can't include everything. I know some operators in New Jersey brag that they use 150% or 175% of, which, because they're paying millions of dollars in mortgages, which are counted in that direct care spending. So we really need to do more work on that. And that's the ultimate goal here, is to make sure that a portion of every dollar is going to actual care.
Thank you. That's a great way to end. Sam, thank you so much. Thank you, everyone who joined us. Again, Sam's program is now available. The PowerPoint is on our website, and the program itself, the recording, will be available by next Monday. Thanks, everyone. Thank you again, Sam. Have a great day.
All
Bye-bye
right,
now.
take care, everyone.